Hello everyone and welcome to our live session where we are going to talk about the fascinating topic of digestive osteopathy. We will be discussing about what exactly digestive osteopathy is, what are the physiological changes that happen in digestive osteopathy, what are the conditions in which digestive osteopathy can help, and of course I will be taking questions from you. In case you have any questions related to digestive osteopathy, definitely we will be discussing that. But before that, I would like to inform you that this week, that is from 18th to 20th of October, we are in Ahmedabad and we have already got 2 days which is scheduled with patients, and I think we have one more day, Sunday, where we have left with appointments. So in case if you're looking to see us in Ahmedabad, the number for appointment is 8006738000. I'll pin this comment in case you need to check it through, and I hope I'm audible. So guys, talking about digestive osteopathy, you can certainly put in your questions, which I will kind of check after the session once we are done with the session. But let's talk about digestive osteopathy. So why digestive or suddenly osteopathy, and what is the relevance actually? So a lot of patients that I saw, of course, related to joint pain, neck and back pain, what I found is a lot of these patients have issues which was related more to acidity, which had issues which was related more to gut. And this clearly explains the concept of digestive osteopathy. In digestive osteopathy, the body is considered as a structural unit, and though the system is completely from a digestive process and has more to do with the gut, but it is the overall nervous system, it is also the muscles, the joints, which equally have an impact on the digestive system, because of which it can clearly be a vice versa situation. So looking to help your digestive system can actually help you also to reduce your joint pains a lot of times. And yes, we also seem to have a lot of issues, or complaints related to digestive issues. So talking about what exactly is digestive osteopathy, like I told you, in osteopathy science, it is considered that body is a structural unit, and whenever you have a problem in certain one of these areas, it will clearly reflect on other areas also. On the same basis, if there is an issue with gut, then you will also see problems related, or it will also spread on to other areas, which could be your joints, which could be your small joints, which could also be a back pain. Sometimes probably just an issue in the abdomen can also lead to back pain. As a clinician, I will just keep on treating your back pain, but without realizing that I have to also work on your abdominal area. So that's where the whole physiology or the process of digestive osteopathy takes place. And you might be wondering, when we are doing digestive osteopathy, what is it exactly that we are doing in terms of movement, or probably doing things that externally we can help and try to get these things sorted. So that also has some certain principles. Firstly, digestive system is completely managed also by the nervous system. So it is managed by the autonomic nervous system. Now the autonomic nervous system consists of sympathetic as well as parasympathetic nervous system. Any of these systems, like the sympathetic system, has a fight or a flight response, whereas the parasympathetic system is concerned with rest and being calm. Okay, now any of these systems, if is not working in the right situation, it will give you a problem, whether it is related to digestion, it is related to bloating, it is related to happening gases that can happen in your abdomen, or even future taking up things like causing ulcers or even IBS. So these are the problems that can actually cause because of these things. Then talking about visceral manipulation, which is actually the movement of organs, whether it is the stomach, whether it is the liver, whether it is the duodenum. There are certain kind of movements that are done, which can help you for constipation, which can actually help you to improve your peristalsis, and also help in improving your overall issues related to constipation. So these are certain movements that we actually do in digestive osteopathy. Besides this, trying to improve the overall circulation. of the abdomen, and also improving the lymphatic drainage. There are certain points in the whole abdominal area, whether it is a right quadrant, left quadrant, lower quadrant, upper quadrant. There are different pointers which you need to kind of release when we do these digestive process. So when you see some of my videos where I am doing the digestive process, you may feel that these are just certain movements which are probably just the same or happening in a different or happening in the similar manner, but there are certain areas which we are working on. We are sometimes working in order to align the stomach, we are sometimes working in order to align the navel area, and most of all we also work on the diaphragm and the breathing pattern of your body, because that is one of the most important thing. If you have the right breathing pattern, you understand that you are carrying more oxygen. Better oxygenation means better blood, better supply to the muscles, blood supply to the muscles, and all of these things. So and whenever you have a lower amount of oxygenation, like you are breathing partially, you're breathing with a very upper area or just a little bit of abdominal area, obviously that causes issues for all your areas. Okay, so improving on your diaphragmatic breathing is one of the most important things. When we do a session with digestive osteopathy, we work and we stimulate the diaphragm muscle. We try to stretch the diaphragm muscle in such a way that while breathing it can activate further and try to improve and open up the whole of your abdomen as you are breathing. Then one more important, very important concept about digestive osteopathy is myofascial release. We have to understand the global positioning of your fascia, because all your organs are actually kept in a pouch. Most of the organs are kept in small pouches. These are called greater omentum and lesser omentum. Now these are pouches where your organs are actually kept in order to ensure that if there is any infection to any one area, that infection doesn't spread off. But at the same time, we need to understand that whenever there is an injury or any sort of inflammation, that pouch starts contracting in size, because of which the organ also starts shrinking in size. When you do a myofascial release, you are actually trying to stretch the fascia, you're actually trying to reposition the organ, and you're trying to open up the fascia as much as possible. So that is also one of the things that happens when we are doing myofascial release. So talking about what are the conditions in which this can help. So one of the most important conditions where digestive osteopathy can help is IBS, irritable bowel syndrome. We can see that a lot of people have issues related to digestion. Then they also have issues, they will always feel bloating or pain in the abdomen. Now one of the most important reason is the gut is really irritated and insensitive. So what happens is, exactly whenever there is an insensitive gut, you will feel these problems. So that's where we try and see that things are taken care of. You do the right sort of movement and help in IBS too. Then talking about different conditions like constipation, indigestion, acid reflux. Acid reflux is one of the most important conditions where you will see the digestive system working very hard. See, acid is a very important and component of your body. Your stomach needs as much acid to help the food getting digested. But the moment that acid starts coming into your esophageal area, that is what feels like an acid reflux. So all it needs is the right positioning of your esophagus, and if that is going right, you will see a lot of changes happening in your acid reflux problems. So just having medicines for all these purposes can only kind of reduce the symptom, but in a long run, what is most important is having the right sort of healthy lifestyle, because eating the right time when it comes to your dinner and overall the food timing, taking care of your food habits, especially spicy foods and things that irritate your gut. That is one of the most important thing, and it's very, very subjective. You need to understand that, and you need to see how you can take care of that. So basically guys, this is about digestive osteopathy, and it is not just for people who have only issues and they should come to me for digestive osteopathy. It is also a preventive state. A healthy gut is as good as taking care of your overall joints and body. So definitely a healthy gut is one of the most important aspect of a healthy body. So even if you do these sessions to get yourself checked and understand that if you really need certain things in terms of intervention, so that can definitely help out. So yes, this is all about digestive osteopathy, and like I told you, the importance of healthy lifestyle is also very, very important, and it has to be, implemented all the time. So I'm going to take a few questions. I can see that there are a few questions we have. Yes, if you have any questions about digestive osteopathy, you can type in, and if I can read that, definitely I will answer to your questions. Yes, I can. Bikash Das has a question. Odisha में एक बार कैंप कीजिए. Odisha में कैंप प्लान तो नहीं है, but we will see how we can do that. Definitely. So Azaya Aldobai has a question. I have back issues, but it is good for me in treatment. Is it good for me in treatment of pregnancy? Well, for me, in case of pregnancy, well, if you are pregnant, and so the first 2 months is not really suggested, and again we cannot do this kind of therapy in the 8th and the 9th month, so it is not very advisable. We can be very easy and careful when it comes to chiropractic therapy, but if you have back pain, we can do more of myofascial releases and a little bit of manipulation, depending upon how your structures are in terms of tightness. Okay, but normally I have seen a lot of pregnant women when it comes to chiropractic therapy, but it has been more for the neck area, less for the back area. Hi, good evening, Naresh. Nirav has a question. Ankylosing spondylitis, back posture is gone bad. Yes, in severe cases of ankylosing spondylitis, you tend to have a hump, and then yes, definitely there are issues. So Nirav, the best solution, what a lot of patients feel, that ankylosing spondylitis, you should have more and more medicines, but let me tell you, medicine is not the solution for it. Yes, it is good to reduce your pain in the short term, but the long term solution for ankylosing spondylitis is just having the right sort of exercises. Even chiropractic therapy can work, but there is a limitation there. It cannot be completely helpful, especially in severe stages. So, but movement is the medicine. The more you move and the kind of exercise that you select. So it's important that you select exercises which are low impact but high intensity. For high impact, low impact, yes, and high intensity. For example, doing exercise in a swimming pool, or doing exercise and lying down on a bed, so that reduces your impact, which is very important for you. Otherwise, you will also have further complaints with joint pain. Naresh Chaudhary has a question. When will you be available in Navi Mumbai? I'm based in Thane, and I'm available in Thane on Monday, Wednesday, Friday on a regular basis. If I'm not traveling, tomorrow onwards I'm traveling to Ahmedabad, so I'll be not there immediately, but yes, I will be there next Wednesday in Thane. Mohit has a question. Does vital B and D deficiency lead to slower healing of joint pain? Definitely. I ask all my patients whether their D3 and B12 levels, how are the D3 and B12 levels, and I always tell them that you should ensure that you get your D3 and B12 level to the optimal levels, because a lot of times we end up having deficiencies in these areas. We don't realize that, and we are just having stiff joints. We keep taking medicines, and things still don't progress. So even before you take medicine, it is important that you either check your D3, and if you have never taken D3, maybe you should also consider taking a dose as per your physician. Sure, Naresh, you can see me next week, and I'll be there in Thane. Thank you so much everyone for joining in, and this was a session on digestive osteopathy. I hope you liked this session, and if you have any doubts or any question about this session, do put in your comments. And any other topic where you would want me to go live or have your questions, you can definitely put in the comments. Once again, I would like to remind you that our session now, the next session scheduled camp is in Ahmedabad. We are in Ahmedabad from 18th to 20th of October, that is Friday, Saturday, Sunday, and we already have our 2 days booked. We have a few slots left on the last day, so you can connect us on this number which I have already pinned in the comment section, 800-673-8000, and looking forward to see you improving your spine and aligning your spine and improving your lives. Thank you so much.